I'm Dr. Marcia Sonity,
And I'm Dr. Caleb Moore,
and this is the
the Free
Free
Smiles
Smiles
Podcast.
Podcast.
We are talking about holistic dentistry today and how to practice that clinically and how to provide a holistic approach for patients.
Yeah, so I think the one thing that I think of, or a lot of people think of when they think of holistic dentistry, is like weird woo-woo things. You know what I mean? They're like, "Oh, you're a holistic dentist. What does that mean?"
Right.
And I think that can mean something different for each holistic dentist. But I think the things that are not true about holistic
Let's start
dentistry,
there. Yes.
is that
Two truths and a lie.
two truths. Right? Tell me which one you think it is.
Right.
Is that you're not going to come in and I'm not going to say you need all your teeth removed and that
Right.
you need, titanium or zirconia implants because whatever. I'm not going to tell you that every single one of your fillings needs to be replaced.
Yeah.
And I'm not going to tell you that things can just be reversed. But there
Right.
are truths to all these things that kind of come through holistic dentistry. It's just not. Yeah, it's just not what I think, like, some people's perception, even, like, in our own career field, like, other dentists, they're like, "Oh, what, like, what are
Right.
these holistic dentists doing out there?" And I think my goal is always to, like, make a good name for holistic dentistry,
Yeah.
that I'm just a vessel of information. I'm just presenting my patients with, "Hey, these are your concerns that you're coming to me with, and I'm gonna give you the research and the facts that supports X, Y, and Z of all these different options, and you can choose what you want for your health." And I think
Exactly.
that's what most people want out of their healthcare, you
Right.
know?
Yeah. So it's funny because a lot of the things that we're going to talk about today, I actually practice myself, but I don't label myself as a holistic dentist. But I know that you are more in that realm. So what accreditation or what groups are you a part of that really, you just transitioned your type of practice, to holistic dentistry.
Yep.
So, how are you kind of diving into that?
Yeah, so I think the first thing that I did, I became a member of the IAOMT, which is essentially like the international kind of body that kind of provides guidelines for holistic dentists. Like, they go
Hmm.
through research. I'm actually going to the conference next week,
Nice.
in Salt Lake. I'm SMART certified. So SMART certification is the practice of how to safely remove amalgam.
Yep.
So there's a whole certification process that we go through a course. You have to do a presentation to them, which I've completed, and then attending a in-person course as well. So that is the two main things. The office that I work with, the doctor that I work with is also a holistic dentist. He is a naturopath, so he has
Yep.
naturopathic training. Also IAOMT. He's been in this field for 15 years as a holistic dentist, 20 years, I think, before that, just doing general dentistry. So that's like the main caveat. I mean, there's so many different certifications that you can get,
Hmm.
but that is my current ones.
Okay, one thing, this is like on the forefront of my mind about holistic dentistry. It brings me back to during COVID when we were all being extremely cautious, right? Like PPE was at an all-time high,
Yep.
and we had those like little machines. I know what they're called, but I'm just,
Yeah.
you have those little machines that would come forward, right?
External
The
sections.
external sections,
Mhm.
right? So how is that applicable to holistic dentistry in every day, and are you using them in
Yep,
practice?
yep. So part of the SMART product. So let's go back to, like, why.
Right.
I'm always about,
What?
like, why am I doing this?
Yeah.
I don't just, like, willy-nilly like to practice anything. So when it comes to amalgam, so this is something that they teach in dental schools. This
Yep.
is cold hard facts, is that the most dangerous part of amalgam fillings is the removal. So the vapor
Hmm.
that's created when we're removing them. So during the SMART protocol of removing a mercury filling, we are doing a stepwise fashion of doing that. So not only are we barriering, I hate that word, barriering off your tooth and your tissues. So none of that amalgam is getting onto your tissues, which can be
Yep.
absorbed into it. So we're creating a barrier there. And then we are having you breathe oxygen. So we're actually putting a nasal cannula over your face. We are covering any exposed skin that you may have. So you're breathing 100% oxygen the entire time that we're removing that. And then we're using a high volume suction on the assistant side and then an external suction in front of you.
Nice.
My office also has certain scavengers in the ceilings of each of our operatories that actually filter the air of any kind of particles. And then sometimes, depending, we actually have like the door or window open in the office during that amalgam, depending on how many we're doing or how big that may be. And that can be if we're taking off an old PFM and we're not sure what's
Right.
underneath it. 'Cause that's a huge part of it, is like you have these crowns that have been on there for 15, 20 years. And more often than not, I'm finding mercury underneath them. And sometimes mercury underneath them and then a filling on top of that and
Yep.
then a crown on top of that.
Yep.
So it's these just like sneaky things like that that we'll discover them with. But that's a protocol. We also wear certain barriers, certain face masks, and masks when we're doing that part of it as well.
Yes.
Yeah.
So besides mercury removal or amalgam removal, ultimately there is a huge change in, and I don't want to name names, but like all of these products that we can offer to people and what we give to patients, in terms of guidance, from a holistic aspect, even as simple as like how do people keep their teeth clean in a healthy way?
Yeah.
What are you recommending to people?
Yeah, so my biggest go-to is always a pH balancing rinse of some sort. If someone wants a fluoride, then there is fluoride options for that. If someone does not want a fluoride, there is natural ways to, or very minimal ways to do that.
Right.
The most natural way, the most like least amount of ingredients that you need would be just baking soda, water, into a swishing, into a rinse for yourself. I add a couple different essential oils into mine, but that's what I use. The other one would be a nanohydroxyapatite toothpaste.
Exactly.
There's a couple brands that I usually recommend for my patients. There's a couple more coming out on the market, which I'm excited about, but I'm waiting to kind of hear what the research is, because there's different qualities, as they say, of nanohydroxyapatite. So that's the biggest thing. And I'm big on diet and just like pH in your diet. Like that's my biggest conversation with patients is what are you eating? Because even if you're swishing with a pH balancing rinse or using this toothpaste, it's like that's like the afterthought, where I think we need to go to the root cause of like, why is this happening in your mouth specifically? So that's kind of what I do. Yeah.
Yeah, and I think balancing pH is huge. I'm offering, treatment rinse, maintenance rinses that help balance pH. I've been offering this for years. I actually learned about it right out of hygiene school, like almost 10 years ago, which is crazy. But the spry products, so
xylitol.
like xylitol, yeah. And so, patients are like, well, how can I combat this without, they don't want a really abrasive or harsh toothpaste or rinse that has alcohol in it.
Yeah, which neither do we.
No, I don't either. I'm like, I would never offer you that. But I have found offering like spry gum, mints, their toothpaste, anything with xylitol, hydroxyapatite, is really just, number one, I love their products, but number two, the benefits of that are huge.
Yeah. I think the biggest thing is being simple and being as like natural as possible. Like that's just what most people want, and that's what's going to be the most effective anyways. Like there was actually a huge article that came out in the ADA with it was one of the professors that we worked with. I'll think of his name. But he came on, he was talking about oil pulling, because there used to be like, I mean, at least when I was in hygiene school 15 years ago or whatever it was, they used to be like, oh, this is a wives' tale. You should never do, like, this is which, I mean, there's always some kind of truth to like an old remedy. Like I've read a lot of Chinese medicine books. Like I know that a lot of these things, there's like a truth to it, but it's knowing like how far can this actually like help or do things. Like I'm not telling a patient, oh, you should oil pull because it's going to cure all your cavities.
Right, like you have cavities that are into the dentin, so just oil pull and it'll be okay.
Right, yeah.
No,
so it's like there's a point, exactly, there's a point into that disease or that cavity state or caries state that we can remineralize, which is why we have things like Curadont now, which can remineralize it's a treatment we can do. But it's like it's unfortunate that like a lot on the internet is saying like, oh, you do these things and like you're listening to someone who's probably some kind of influencer. It's not that I'm not discrediting that. It's just like it's like a one size fits all. Like I do this, so everyone should do this. Buy this product, and then they're gonna get some kind of kickback from selling that product. That's what it's all about. That's where TikTok gets all of its views from, and whatever it is. And I'm not against that. It just when it comes to your personal health, like having that good relationship and finding that kind of
Hmm.
doctor or dentist or naturopath that you really trust to work with for your specific goals, that's the biggest part of it. And I think once you find that person, it's just like, don't listen to the internet
Right.
and bring questions. Like I like to have questions from patients about like, hey, I read about this, or this is a new toothbrush. And that's one thing I love is like this. I've heard two patients now talk about this new toothbrush that I've looked up. That's like the worst. So I'm not gonna name names because maybe
Right.
they'll whatever. But um, it's like these like clickbait products that they try to push, and I don't know. There's some good things, but there's always a lot of bad things.
Well, and I think it's having different resources for your patients and staying up to date on what they do and how they work, right? Because some patients may be really sensitive to xylitol,
Yeah,
right?
for sure.
Like they may not have a good reaction to that. So then we have to go over to the nanohydroxyapatite or, fluoride if they're
Yeah.
open
Or
to
even like
it,
an MI paste.
or an
Like,
MI paste,
yeah,
right? So there are
right.
different products out there. And so I really, I, I get upset, right? Because I feel like there's this huge divide. There's always a divide in our country and, whatever. But like, there's this huge divide of like, you should have fluoride or you shouldn't have fluoride or you should, stay away from like Listerine or, whatever it may be.
Yeah.
But at the end of the day, what works for somebody is, I'm glad that it works for them. And I'm going to have other resources in my tool belt that are going to help you in the most, natural way for your body specifically, right?
Yeah. Well, exactly. And like, who am I? Like, if someone wants to come in and they're like, "Hey, I don't want metal. I'm
Exactly.
really sensitive to certain metals." Which is it's a very true thing. Like, what we will oftentimes offer our patients is and this is like a mercury thing, but there's a mercury tri test. It's actually a local company that does it, and you can actually see the different levels of mercury in your body. It's a tri test because it tests for 3 different versions or isotopes of mercury. One of them being isolated to specific like amalgam fillings in your mouth.
Yes.
One of them is coming from like food, like eating a lot of tuna. Obviously,
Yep.
can increase your levels of mercury in your blood. But if you're coming to me and you're like, "Hey, I have high levels of mercury. Have you taken this test? Is it coming from these broken down, fractured fillings that are in your mouth that are now just like throwing off bits of amalgam that you've been swallowing
Right.
for X amount of years?" But it's not my job to be like, "Hey, I don't believe you." It's just like, hey, let's get down to what it is that you are sensitive to. And there's also like sensitivity tests that we run our patients through. Like they can actually go and get blood work. We send them to get blood work. We have a whole list with this company of all the products that we use in our office, and they can literally they email it
Right.
back to us, and it tells us what they're sensitive to.
Yep.
In our office, it's like none of the things because we've literally filtered out everything to be as biocompatible as possible. But
Right.
those are the things that they're true things. So people have sensitivities to things, and sometimes things we use in medicine don't work for everyone. It's
Yep.
not a one size fits all kind of approach. Like certain people can't have titanium in their body and they need something else or whatever it may be.
Right.
Yeah.
And I think, when we think about holistic dentistry, it's biocompatibility for everybody. That doesn't always mean products or, what we're using to be preventative. It also means being preventative in other ways clinically, right? Being minimally invasive. Looking at the mouth as a whole and how it functions, like we've talked about before. So how are you practicing minimally invasively as a holistic dentist?
Yeah, I think my biggest thing that's on my mind today when it comes to that is like breathing airway, like prevention of like obstructive sleep apnea and learning like the early signs of that. Like whenever I have a young person in my chair, I'm always looking for what's their arch growth, even at
Yep.
as young as age 3. Actually just went to a class recently that talked about how Invisalign's coming up with they have a palatal expander, but it's like a series of them, almost
Nice.
um like the old key palatal
Right.
expander, still relevant, still good.
Yeah.
But for people that don't, such a hard thing. I never had a palatal expander, but for a lot of patients, that's a really hard thing to do. Like you
Yep.
have to have your mom like crank this open.
Right.
But airway is such a huge part of just your overall health. So I think if we're diagnosing that early, talking to my myofunctional therapist that I
Yep.
work with, doing different tongue exercises, throat exercises, making sure that we're getting that at an early age. And if it's later in life, you can still go through those therapies. Like there's
Exactly.
myofunctional therapy for older adults. I think anyone can benefit from that kind of stuff. Breath work, breathing training, nasal training, training your tongue to sit to the roof of your mouth. Um, that's just a whole, like, I feel like word vomit of just what what that part of it is. And that's just one topic. Like that's just
Right.
one topic that I'm really passionate about and really talking to like my patients about.
Right. So your
Yeah.
core is, you know, function, longevity, making sure that the airway isn't compromised, that diet
Mhm.
nutrition is healthy. We're removing, amalgam fillings and any mercury from the body, right?
Yep.
How would you say, like, cosmetically, you're functioning as a holistic dentist as well?
Yeah, I mean, cosmetics, it depends on what that, like, it's really is finding what that patient wants. Because some people, I mean, veneers, anything that's like a ceramic, an Emax, a lithium disilicate, all those things are considered biocompatible
Hmm.
things. Like, they are biocompatible. Some people want like zirconia because that's considered the most biocompatible. But not all zirconia is created equal, and I'm not going
Yep.
down that dive hole of that whole conversation. But I'm also trying to do like no prep things, like things that I'm not
Yep.
touching the tooth, or I'm preventing removing tooth structure to make
Yeah.
your teeth look better. And taking classes to enhance my techniques to make that better, or finding those just different things that I can offer my patients so I don't have to, drill on your teeth.
And I think, you know, holistic to me, it means like looking at somebody as a whole,
Yeah,
right?
for
Like
sure.
looking at the bigger picture,
Hmm.
and if they have a ton of attrition or erosion, and have you been tested for food allergies,
Hmm.
what, like, acid reflux, sleep
Have you had a sleep
apnea?
test? Because there's
Exactly.
the triad of sleep apnea, which is acid erosion,
Yep.
bruxism. People are misdiagnosed with bruxism, but they actually have sleep apnea. So I
Exactly.
always am asking my patients, like, how is your sleep? Are you sleeping well? Am I seeing these signs? I
Yep.
had a young woman come in this week who's moving. She doesn't even live here. She lives in Wyoming, but she found us. So, anyways, so I was talking to her about a few things. She's tried night guard, never actually, things got worse. And so I was like, oh, well, how's your sleep? And she's like,
Hmm.
oh, actually. And we go on this whole thing. And now she's like, oh my gosh, I'm paying attention to this. And now I'm thinking, like, so now she has to get a sleep study, which is going
Right.
to get us so much more information. And then, where do we go from there? Do we do myofunctional therapy with an appliance, or,
Right.
there's so many different avenues.
Yeah, and I think one thing that I want to share is just that at my practice, we actually have like a take-home sleep study.
Yeah.
So, a lot of people will go to the hospital and they're like, well, I don't know if it was accurate because I wasn't sleeping well. And
Mhm.
so I want patients to understand and know that we offer this. Like, you
Yeah.
can take home this test, have a good night's rest in your own bed, and then come back the next day, and then we can evaluate the results together.
Mhm.
Ultimately, I'm not a medical doctor, and I'm not going to diagnose sleep apnea, right? But if we can see that you're having, interferences in breathing, how is that going to relate to what we're doing? If you want veneers or you want to crown your teeth,
Mhm.
are we going to be compromising your airway? So I think having that, I'm really glad that you brought up the airway as a
Yeah.
baseline before you do any cosmetics or any restorative work or adding to
Oh yeah.
teeth. That's so important.
Oh yeah, I'm screening obstructive sleep apnea. I'm screening bite things and
Yep.
just TMJ issues because I mean, I've been burned before when in the beginning of my career where I wasn't in tune with all of those things just all together, and looking and being like, okay, this is not the outcome we wanted, or like
Right.
what we wanted to achieve. And now I will never not look at that.
Right.
Like it is the baseline of everything that I do.
Yeah.
Yeah, for sure. I think the other thing that comes to mind when it comes to like holistics and how we practice, I think there's a lot of controversy when it comes to certain things in dentistry, especially with holistic dentistry. We're kind of looked at as like, oh, they want me to take all my root canal teeth out
Hmm.
and and then there's a whole thing of that. What's your understanding, or what's your kind of knowledge base when it comes to someone who comes in with a root canal tooth, or they need a retreat of a root canal, or
Right.
the research that supports different options for them?
This topic is so controversial right now. It
Right.
really is. However, what I can tell you, in the internet and the research, they all claim that there's nothing that proves that the bacterial load is enough to actually cause, inflammation or problems in your body or an autoimmune response. However, that's not the case for everyone, right?
Exactly.
And so for me, it's like when we get in there and try to clean out these canals and you're putting bleach in them and you're trying to like kill off all this bacteria and
Mhm.
put a dead tooth back into the place, there is a time and a place for that because no matter what we do, there's always bacteria left behind. Always, right? There's always going to be an amount, and for me, my understanding is that if a patient's really young, right? Let's say they're 19 and they have a really bombed out tooth and they need to get a root canal done. Yes, or they say like I heard I need to get a root canal. I'm going to advocate for them to do that to hold the place for a while. However, I'm going to educate them that there is a risk that this root canal will fail,
Mhm.
whether that is in a year from now or 5 years from now, or it could be 10 years. However, there's a chance that you could have bacteria that's left behind and it can cause problems for your body. And I know everyone practices a little bit differently, but for me, age is a huge factor because, implants also only have a lifespan of so long. And also, their systemic health in terms of autoimmune issues or, bacterial sensitivity. So that's, how I'm practicing.
Yeah, I
Yeah.
mean, me as well. Like we have a lot of patients that come to us because they have autoimmune issues,
Yep.
because they have, Lyme disease. I see a Lyme disease patient every single day pretty much.
Yeah.
And that is like you could say, yes, there's just a certain what we call like burden on the system. So
Yes.
maybe this root canal, in a healthy, 20-year-old
Hmm.
isn't causing them problems. But maybe when they're 35 and they have all these other things that are kind of causing them problems or inflammatory problems in their body.
Yep.
And then this is just one other thing. And then you take a CBCT and their
A
sinus is
huge.
totally
Yep.
blown out because they have like this like leaking thing. You know what I mean? It's like,
Exactly.
I think it's unfair to discount patients' concerns and to not give them all that information.
I agree.
Like, even if it's me talking myself out of doing something with that patient. Like I do
Right.
that all day long. I say, hey, these are the options. These are the three things that we can do about this situation.
Yep.
And you can decide whichever one you
You're
want.
in the
Because at the end
driver's
of the
seat.
day,
Yeah.
like the more they're comfortable with that decision, the better our relationship is. And the better I think the relationship with dentists are. Because there's a lot of, I wouldn't say like mistrust in healthcare professionals, but
Hmm.
I think now more than ever, like we just went through a pandemic where everyone was questioning everything in our healthcare system. So I think it's very fair for people to come in and be like, hey,
Right.
like I want to know what like why or what's the possibilities here.
Yeah, and I just recently listened to an interview. John Coyce was interviewed,
Yeah.
and he was talking about one of the things that young dentists need, that they struggle with. It may not be clinical or hand skills; it's risk assessment.
Mhm.
So being able to have that ability to say, what are the risks for you? Like if we do this larger filling, or if we do put this root canal in, what is the outcome going to be for you,
Yeah.
and letting them know that so they can make decisions as well. We can do it together because the reality is if you tell a patient you're going to get a root canal, you need to go get a root canal, and that comes back and they have a huge parl like 2 years later, that's on you, right?
Yeah.
Maybe not always, but at the end of the day, you didn't give them the option
Yeah.
to understand that decision and put them in a position to make those choices.
Well, for sure. And there, we have patients that come in every day for, emergency or a pain, some pain. They're coming in, they're from out of town. This is happening to them, or they're not like a regular patient of ours. And to us, we're trying to give them all that information in such a short amount of time. But
Right.
I am still giving them a referral to our endodontist that we work with,
Exactly.
and I am going to offer them, hey, like if we want to do this in a more biologic way, like we do have medical grade ozone. You can
Yep.
pick it up before your appointment. Our endodontist will use that, and that's just another thing we can put into this canal to help try to like fumigate it essentially the best we
Exactly.
can and to give it the best outcome that we possibly can. Yeah.
Yeah. And I think too, I love that you and I are on the same page of like, we're not going to say, no to root canals. However, people need to feel comfortable in those decisions,
Mhm.
and it's our job to do the research and to offer them, there are ways to have it done safely. And at the end of the day, they're most likely going to be looking at an implant in the area, in the
Well, down
future.
there, and that's just statistics. I
Right,
mean, when you're
exactly.
depending on how old you were, what the situation of that tooth
Yep,
was. I mean, you do the root canal the one time, 10 years later, likely needs a retreat.
yep,
That's X amount of time. Like 50% of them will need a retreat at some point because
yeah,
there's still accessory canals that aren't cleaned out. There's all these different capillary pathways
yep,
that those main canals just aren't being reached. So then there's that retreat option. So then the likelihood of that success of that, depending on the patient's age and all that stuff,
right,
it goes down every time.
yep,
And then there's the risk of fracture. So there's
yep,
so many times, and I think people throw a lot of money and time into retreats
hmm.
because they're like, oh, I'm just, but at the end of the day, you're spending the same at that end than you would have just doing the implant.
There's also an emotional um, aspect to losing a tooth,
100%.
right? And
Yeah.
so I think that people hold on to this idea of it's your natural tooth. Well, it's a dead tooth. It's
Yeah.
holding a place, right? It's not getting the nutrients that it needs anymore. It's drying out over time, at risk for fracture, breaking. It's not functioning in the system the way that it should be after years of having that root canal, right?
Yeah.
So I think getting past that emotional response of like, I'm losing a tooth. No, we're replacing your tooth. We're retiring this one that's no longer working for you,
Yeah.
and we're going to get you a better option.
Yeah, for
Yeah.
sure. I mean, obviously, like, I think both of us agree that we'd rather work on preventing that,
Hmm. Right.
preventing the need
Exactly.
for that. So that's why when it comes to like early diagnosis of things and
Yeah.
trying to really like, I think part of holistic dentistry is doing minimally invasive dentistry and
Right.
catching things when they're early. So yeah, I'm not gonna not do X-rays. Like
Yeah.
when patients come into my office, they're like, "Oh, you're holistic. Why don't you do X-rays, right? Or you don't do X-rays or something like that." They think we're not gonna take X-rays, and it's like, well, no. But if you are worried about radiation, there are these supplements that you can take before we would do this that actually help your body with radiation,
Yeah.
so whatever that is. So we have those options for our patients, and people tend to just kind of accept that a little bit more. But what I want to know is there an early sign of some kind of disease in your mouth that we can take care of? So then we're not just
Yeah.
unknown. That's the whole point of dental x-rays. Like
Yeah.
we're not just trying to radiate you just because we want to do it. You know what I
Exactly.
mean? Like I would love to have x-ray vision just to see it. But we need those things and they don't have to be done every single time you come in for a cleaning. Like it's not every 6 months we're taking them. It could be every 2 years.
Right.
That's totally fine. But if you're at a high risk, then we need to personalize that for you, you know?
Exactly. I totally agree. I think that there are so many aspects to holistic dentistry that people don't quite understand, and I'm happy that you've shared a lot of those today. We're both practicing in a way that, I feel good about. Like, I feel good offering these things to patients and being able to provide them with preventative medicine and just knowing that at the forefront of it, it's risk assessment and prevention.
Yeah, I agree. And I mean, I think at the end of the day, it's all about what you want for your personal health and what you
Mhm.
want out of the longevity of your smile, your
Right.
overall health. I mean, linking it all together. And that could be a holistic doctor for you. That could
Right.
be finding that. And they are, we're all over the place. If you go to the IAOMT website, you can search for a member or someone who is SMART certified, and it's super easy.
Yeah.
And we are out of here.
All
We will
right.
see you next week for the next episode.
Sounds good. All right. We'll see you back.
Bye.
Bye.
Thank you so much for listening. If you enjoyed this episode, please share it with a friend. Don't forget to leave us a comment, rate us, and subscribe so you never miss an episode. We appreciate your support and look forward to bringing you more great content.